Wait, I've never seen or done that.
I've never seen that before.
I didn't like that. Hi, welcome back. We are going to be watching the 6th episode of The Pitt. Just to introduce myself, I'm Peggy. I'm an emergency medicine doctor, and this is my husband, James.
I'm an internal medicine doctor. Hi.
Yay! Thanks for following along. And if you need to find me on social media, I'm very active on Instagram under the same handle, Pegs for Days. I'm also there on TikTok with the same name. We are starting episode 6 of The Pitt.
Crashed ambulance, thieves are en route. ETA 10 minutes, trauma 2 is all yours.
Great. They better be meth head junkies, because Abby wants a Birkin for her birthday.
What are you gonna do with the Birkin?
Hopefully forgive me for getting the kids a golden doodle.
You wanna be a good husband? Send her on a vacation.
Okay, first off, there's no way a resident can afford a Birkin.
Get back. Yeah.
Why don't you take a seat and we'll come find you if there's an update.
Oh, the administrator's in the back, do you see?
Oh, is he? That's why he's hiding? That's funny.
Dr. Rabinovich.
Gloria.
This is Dr. Tracy Morris, Regional Manager of ECQ America.
Regional manager. You love that. You know all about that position.
Mm-hmm. Wait, what is she regional manager?
I don't know. Going over a proposal.
We're interested in having your emergency department join us.
Does your proposal include the part where you cut the pay for all my doctors?
Maybe I can find an incentive for you. How does regional medical director sound? Lighter workload, better benefits, stock options.
That's a lie. Regional medical director works super hard. Truth.
Used to be a regional medical director.
Dr. Rabinovich?
I need you to care about patient satisfaction.
I would love nothing more, but right now the average wait time is 6 hours, and that's before you see a doctor. You need to hire more staff so we can open more inpatient beds. Are you prepared to do that?
So like some groups trying to buy out their ER.
Mm-hmm. Basically, it's a doctor's group having like VEP and what's that? USACS.
Who would have guessed frat boys? Collins. Damn it. I knew they were gonna crash. Need to practice more gratitude.
Oh, they're medical
I'd be a lot
assistants.
more
It says MA.
If my paycheck was...
We don't have MAs in our ER. We have techs.
Yeah, we have techs. Yeah.
Is the tech and the medical assistant the same thing though?
They're very similar, I think, in
But it's
terms of
different
training.
because like the tech is like they do like basic, like life-saving EMT basic things.
I think MAs
Can
can
like
do
an
that too.
MA can an MA do like CPR and like EKGs?
They
and
could do BLS, yeah, and they can do a EKG. I mean, they can't interpret it.
Right.
but-
Oh, okay.
Yeah. I think it's very similar.
I don't work with any medical assistants. I just work with techs.
Installing
Thanks, guys.
lighting fixture in the
Dr. Santos on EFAST, please.
Dr. Garcia, can you spell world?
WORLD.
Start with D, spell backwards.
DLROW.
Excellent, your brain is fine.
Pulse 92.
We don't have to spell world during a trauma assessment.
You probably cracked a rib or two.
Check for lung sliding. It could be a pneumo.
I was gonna paint the living room next. My wife has a whole list of things she wants us to get done.
You can probably tell them what EFAST is. You know what this going on.
That was on episode 1, honey. I explained it.
Did you? Mm-hmm. I don't remember that. That was like 5 months ago.
Episode 1 was 5 months ago.
Wish I could stay post-op hemorrhage.
Tier 1 trauma, ETA now. Tier 1 trauma,
Call me if
ETA
anything
now.
changes.
My tier 1 trauma ETA now, that's exactly what happened at my old place. That's exactly how they would say it. Okay, you were asking me, all right, so this patient fell off a ladder, and then they're asking him like what happened, because sometimes in emergency medicine, we have to figure out if we're only dealing with a traumatic injury or what caused the accident. Was it something medical that caused someone to have the accident? Because if you're only focusing on like what did you break from the fall, you might miss them having their stroke or heart attack or something that caused them to do the fall or crash their car, for example. So sometimes you have to have like both a medical and a traumatic workup and keep that kind of like open mind and look for those types of things instead of just honing in on only the obvious broken arm or something, for example. And then James was just asking me to explain what an EFAST was because it's been a long time since episode 1. But when they ultrasound, it's like for a traumatic. When a patient comes in with a trauma presentation, we can do a quick EFAST. And EFAST is basically a focused abdominal sonographic, like traumatic examination. And it just says we're looking for obvious signs of large internal like hemorrhage. But it doesn't rule out anything. It doesn't mean that you don't have any injuries if it's normal. It just means that there's nothing super obviously wrong and unstable yet or right now. So it's just a quick way for us to look, okay, there's no obvious large amount of bleeding or there's no obvious like collapsed lung.
Yeah. I just want to add one more thing. It's been proven that patient satisfaction scores are negatively correlated. In other words, it causes more harm than good.
What causes more harm than good?
When the association between patient satisfaction scores and patient outcomes. So basically, the more satisfied a patient is, the worse their outcome is.
Oh, that's very interesting. Okay, I thought you were talking about like doing the ultrasound. I was like, what? Okay,
Oh, no,
so
no,
you're
no.
saying like the more like if the patient satisfaction score is higher, their outcome scores are worse, and then when their satisfaction is lower, their also outcome like medical outcomes are much better.
Yeah, there's not. I mean, it's not much. It's like
It's just inversely correlated.
it's inversely correlated, right? There's a lot of theories behind it. Like, if you ask for a lot of narcotics, your patient satisfaction score will go up, but then it may not actually be good for you. Just like if your doctor's like, oh, everything's fine, but then they miss out on all the important stuff. I mean, that's hypothetical, but
That's very interesting. Thanks, James.
No problem.
I didn't know that.
Breast sounds bilateral, but lots of striders. Set up for intubation. We gotta fix this fast.
Posterior hip dislocation. Good pedal pulse.
We need induction meds, ketamine and rock.
Oh, look at this clavicle.
Compressed centrally. Sternoclavicular dislocation.
It's compressing his trachea.
Reduce it, see if it helps his breathing.
Board morphine. Draw a rainbow.
Well, they're saying that from the car accident, he dislocated his hip.
No blood in the orifice.
and he also has a dislocated.
Sternoclavicular displacement, right?
How does that compress the trachea? I've never seen anything like that.
Tell clip.
All right, go deep. You want to get a really good grip on both sides of that ball.
Got it.
Wait, I've never seen or done that.
I've never seen
Oh,
that before.
I didn't like that.
How's your breathing? Better.
Yeah, so basically what he was doing, he's like pulling, he's saying that there was a sternal, like our sternum's in the middle of the rib cage, clavicular, which is your collarbone, displacement slash like, yeah, like
It's like a dislocation.
a dislocation,
Normally,
like it was like pushed backward and pushing onto his airway.
Yeah, normally this bone and this one are connected together. It's like the joint, and
Yeah.
I'm guessing this one just dislodged. Although
No, it was like
must've-
pushing back, so he's pulling it out forward.
Right, but I didn't know it could cross the midline to hit the trachea. I've never seen that before.
I don't know if that is crossing the midline. Maybe it's just like the right side. But I mean, the point is, it does. I have seen sternoclavicular misalignment. I haven't seen it been so bad where it's like pushing on their trachea and you must do something emergently at the bedside. Like I've never seen that. But when there is that kind of injury, it is a sign of a very, very severe trauma. That takes a lot of force. Like this kind of injury is very rare.
Yeah.
But yeah, I've never seen it where we actually have to go and relocate it. I was like, oh, I don't know how to do that.
I've never seen that before.
Yeah.
I've never even heard of that before.
I mean,
Like to do it from the ER. I mean, I'm
no,
not the
I've never.
dislocation.
No, I
but
don't
in
ever
the
do that in
ER.
the ER. I don't think. Ask how many emergency medicine doctors have done that. That's very rare.
Yeah.
Oh, and then the last trauma patient when they're like, spell world backwards. I was like, we don't have time to do that in a traumatic assessment. They're just like, we just ask basically, which is like, what's your name? Do you remember what happened? Do you know where we are? Okay, this guy's with it. Like, I don't need to like ask you like complicated like problem solving questions to get an idea of where your neurologic status is.
Yeah. If you just punch me in the face, even if I'm fine, I probably wouldn't be able to spell world backwards.
Anyway, okay, so yeah, that was very rare and weird for me to watch and kind of.
Yeah. Bad butt injections.
How bad does it look? I'm gonna be honest with you, it doesn't look great.
It was like a Brazilian
butt lift, but gone wrong. Yeah.
Oh.
Been in with her for a few minutes.
Seen too many of those.
22 complications from silicone butt injections.
Yep.
So call the clinic that did it.
She found the guy on TikTok. He did the injections in his living room.
Oh, so many stories about
That's
this.
such a common story.
Jesus.
She's tachycardic and tachypnic. I think it's a panic attack, but if a piece of silicone hit a vein, she could have a pulmonary embolism. We should scan her.
Good.
I want to tell them what one of our doctor friends told us about the butt lifts. It's the most dangerous procedure in.
Oh yeah, I mean we have a friend
cosmetic
that's a
surgery.
plastic surgeon, like his former classmate. But yeah, like Brazilian butt lifts and those kinds of. I'm no surgeon, but like our plastic surgeon friends is they're very high risk, and they must be done well with professionals. And the stories of like finding someone online on social media and doing it in their living room, like an unauthorized, not real doctor, that we get stories like that all the time, and it's really scary, and we have seen people die from it too.
Yeah, they. I think she said it was the highest highest risk out of cosmetic surgeries because it's like a very vascular area. Like butt has lots of veins, and you're just trying to inject like a ton of, whether it doesn't matter if it's silicone or if it's fat or
You're just
whatever.
trying to inject a
You're
lot
just
of
trying to
volume
inject
into
a
that
large
area.
amount of stuff into the area, and like inevitably at some point you're gonna hit like a vein, and if that carries that whatever it is,
Or artery, yeah.
artery to your heart or to like a blood vessel and clogs it, then it's very bad. You could die from that.
Life-threatening, yeah.
I've also seen personally a case gone wrong of a woman on the East Coast who went to a fake doctor and then he injected cement instead of silicone.
I've read that kind of stories online too.
Yeah, it happens
Like,
a lot.
yeah.
It's not like
Yeah.
It's not like this is like it happens a lot.
Or like we get a lot of stories of like people that went outside of, like, we're in the United States, but they went to another country, Latin American country or some other country to get like cheap plastic surgery or augmentation or injections, and then like they fly back and like they have all the complications.
Yeah.
And then I'm like, I'm a plastic surgeon, but this doesn't look right.
So let's discharge before we start with somebody new, okay? So make sure that your decision making and your notes reflect not just the diagnosis, but all the thought that you put into ruling out all the critical illnesses.
The hospital won't admit this, but it's less about charting and more about profit.
Okay? Good.
Mm-hmm.
That's it.
All those things are, well, I agree with most of the things he said.
Oh yeah, for sure.
Yeah, so like, I remember being a resident and my attending program director told us first day, like, sit down next to the patients if you can. There's not always a chair, so we don't always get to, but if we can, it's nice. It makes the patients feel much more like we're present and listening to them. The thing about like discharge patients before seeing new patients, I think that's a style thing because my attendings would always say, see new first, like see the new patient first. Because, and I don't think it means like go into a full length discussion in the exam, but at least like look at them, make sure they're okay before you like go and take care of like discharged patients and stuff, because you want to make sure no new patients come in that are unstable. So he'd always be like, see the new first and then go and disposition. We call it disposition is like, where are they headed? Are they getting admitted to the hospital or are they going home? Are they getting discharged? So he's like, disposition. But yeah, it's important to discharge patients that are waiting for discharge, obviously, because it's important for us. Patients, they have places to be. Their time is important as well, but we also need that bed space to see new patients too. And then exactly what he's saying, like about like more things that need to write in your medical chart. Okay, I hate medical charting. It's the worst part of my job by far. And then there's like all these like rules that are set by like billing companies to make more money.
It makes no sense. I mean, basically it makes the notes like unreadable because they're so long.
It's a lot of things that are like required to put in there.
Yeah. Well, it wasn't this because of this. It wasn't this. I mean,
Yeah.
It's a note that's like 20 things that it's not, and then all you want to know is like, so
Like,
what was it?
So what did the patient have? What did you give them and stuff? But you're like, I thought of this and it wasn't this and I checked this, and it's like, it's just put in there because we have to for billing purposes. And it takes up so much of my time, and it takes me away from the patients, and it's the worst part. It's the reason why I stay late after my shifts.
I don't need anybody else associating me with my mom. I know, but I just can't say no to a hot appy.
She's saying hot appy, like she's saying basically appendicitis. That's just slang for hot appendicitis, just like acute appendicitis.
Tell me the name of this sign. Tim, raise your right leg, please.
Oh. Psoas sign, causing friction of the psoas muscle over the inflamed appendix.
Excellent.
Hey, Silas, wake up.
Lost the radial pulse.
Thready carotid, his BP's crashing. I think he might need a chest tube.
She's smiling.
Get type specific from the blood bank.
Hypotensive patient from traumatic injury.
Pulse ox to 89.
I prefer chest tube, 20 French. I would love to do the chest tube.
You got it. I'll guide you.
Fuck! Oh my god, are you okay?
Oh, that's gotta hurt.
Leave it, but
It went into her foot.
Yeah.
I mean, that's a pretty sharp knife to go through a shoe into the foot.
It's actually really hard to cut through a shoe like that.
I mean, but the point is like that she got injured by the trainee.
Yeah.
Which happens actually all the time, unfortunately.
Yeah.
That's like one of the most, I think, likely points, I think, when people get injured is at work is when two people are working together, and inevitably someone will accidentally stick the other person with either a needle or, in this case, a scalpel. I've never dropped one, but like, yeah.
I'm sure it happens. I'm sure
I'm sure it
scalpels.
happens. But no, like commonly sticking like a needle stick when you accidentally, when you're doing a procedure with a trainee, I always keep my hands out of the field or like talk to them and be like, hey, do this way, because I know when someone else is directing something sharp, I don't want it to be anywhere near. But I guess she wasn't even near. It dropped into her foot. But yeah, I hate that. And
it's actually very hard to cut through fabric like that.
I know, and I was like, oh, that doesn't seem realistic. But I mean, the point is, like, we do get occasional work-related exposures and to blood and stuff like that. And it's not. I mean, I try to minimize it. I think it only happened once in my life as a student, but.
That's why they tell you to wear closed-toed shoes.
And I double glove always, and I wear face protection always.
Yep.
Okay, you're gonna pretend you're a pirate with your foot on a keg of rum.
Are you serious? Yep.
Oh, this is the hip dislocation.
Hip reduction.
Put your right leg behind his knee.
Like this? Oh.
Yeah, and you are going to use your leg as a hinge to put anterior force on his femur.
Physics.
Push down on the lower leg with your left hand.
You got this.
You're not gonna put the smallest girl doing all the physical work.
Boom!
I mean, shoot.
That is what a hip reduction feels like.
Thank you.
Hip reductions are rare. It happens for sure, but it's rare. I don't think I actually have ever gotten to do one. But yeah, no, I mean, the orthopedic friend that I have, she's a woman. She's a badass orthopedic surgeon. She's like, I was like, I'm so hard. Like, she's like, if you do it right, you don't need to be huge. It's about like the right force at the right place. Spoken like a true badass lady in orthopedics.
Dr. Robbie, Nick Bradley's cerebral perfusion studies back.
No blood flow past the brainstem. Okay.
I've never seen a cerebral perfusion study result.
Nope.
I wouldn't know how to interpret that.
Nope.
But that's sad. It sounds sad.
Unfortunately, it shows that there's no blood flow to Nick's brain. He's brain dead. I am so very sorry.
Duroform first, then 2 cut 4x4s.
This is the next still sticking out of her shoe.
Yeah.
It is?
What? No, sorry, no, the knife's not there, but she's still bleeding. I can't believe she hasn't gotten to.
Because I think he has a tension pneumothorax, so they couldn't just leave him.
I see.
Stabilize him first. And she liked her too, because she was like sticking up her, remember?
Yeah.
Let's take a look. You see what I'm seeing? Neuroassisted psychosis.
Which one was that?
The guy that had a seizure in the waiting room.
Oh.
You're saying he has neuroassisted psychosis.
No blood flow here at all.
Is that dangerous?
If it goes untreated for more than 6 hours, he could lose a testicle. It's really important that I try and fix this now.
Okay.
Oh, so they go to surgery. I gotta fix this in the ER.
Oh, I've done this.
Wait, what do? You just try to
untwist it. And they'll still like need surgery. You still try at the bedside.
Oh, I see.
They may still
You
need
just
surgery.
manually try to do it.
Yeah, manually detorse it.
I see. What's the point though? You have to just take them straight to the OR, no?
Because they're not there at the OR. Like, if you could untwist it now, like, they're not in the OR at that moment.
I see. Just buy some time.
Yeah. I actually fixed somebody. I untwisted the testicle. I fixed it. He's no more pain. I ultrasound afterwards. Total normal blood flow.
But they still have to staple it down though, don't they?
That's what I said. Anyway, this was years ago. It's not hard. You just go like this.
Yeah, I know.
Most of the time, the torsion is to the inside, so we rotate outward by opening the book.
I will speak to Teresa. I will see if she's talked to her son.
You should admit her.
Admit her?
She's good physically, but she made herself sick to get her son. Clearly not coping, and she needs professional help.
She would never meet criteria for inpatient psych.
Neurocystic sarcosis, a parasite in your brain.
So there's going to be a worm graveyard in my brain forever.
But they're resting in peace.
I mean, we see neuroassisted psychosis.
Yeah, we see it. Undercooked pork.
Yeah, a lot of like undercooked pork, or patients that come to us from other countries. They get it more commonly. But I haven't had it where it like has caused a patient to have seizures.
Yeah, I mean, it's a risk factor for seizures.
Yeah.
Take some medications.
Yeah.
I've actually never seen an active seizure from it, but it happens.
I think usually when we see it on CT, it's usually just an incidental, like, oh look, by the way, there's also this thing that was in your brain before.
Yeah.
But parasitology was very, very gross and fascinating.
Oh, it was my favorite.
It was like all the horrible things that can like crawl into your body. I was like, but it was very interesting, and I thought for a hot second I might do ID. infectious disease.
Unfortunately, if you do ID, unless you work in a third world country, you're never actually gonna.
There's very little of infectious disease here is in parasitology, but it's just very interesting and gross.
Fuck it. I dropped a scalpel and it stuck into Garcia's foot.
Oh, that's bad.
It might actually be worse than fainting, so.
Well, at least I didn't kill anyone.
The day's only half over.
You killed a patient?
Not really.
You kind of did. I'm sorry you did.
I mean, they're all having bad days. All three of them are having bad days.
At least I'm not the only fuck up here. So long, fellow losers.
Your son's driver's license indicated that he wanted to be an organ and tissue donor upon death. That means he's given his permission for that.
No, I don't want to talk about that. He is still my son!
That's sad.
Yeah, that's unfortunate.
I don't know. How would you feel if your family member or loved one about them becoming an organ donor?
I'd be okay with that.
I guess that's because we're on the other side. We're medical. And we're like okay with it.
Yeah, of course.
Yeah.
I mean, they don't need those organs anymore.
I would want my organs to be donated.
Yeah.
I think I have pretty good organs. I take
For
good care of
now.
But I felt like I mean I would like it if someone else could use parts of me, and then I'd feel like I get to help other people with what happened to me.
Yeah.
But yeah, it's a hard decision to make.
Yeah.
But in the medical field, it's very, very important, and a lot of organ donation is like super necessary for patients to survive. Other patients that need organ transplants and stuff. So it's important.
I'll be right back.
Oh, gynecomastia. She's gonna think he's got some kind of like endocrine disorder.
I noticed some breast enlargement, bilateral and symmetrical with no palpable masses.
What's in the differential diagnosis for male gynecomastia?
Alcoholism.
Definitely alcoholism.
Yeah.
But then there's pituitary and gonadal tumors, and for the rest, hormonal levels, estrogen, testosterone.
What's that to do with the trauma, though? That's great and all, but that's like an outpatient workup.
I think she's just saying like, why did the guy fall? She's looking medically. But you're right. Like, I never order estrogen and testosterone levels in the emergency department. They will not come back immediately.
It'll take forever to come back.
Yeah.
Plus, none of those things cause a fall,
Right.
or a syncope, or anything like that.
Right. But alcoholism could.
Yeah, alcoholism.
Yeah.
Yes, you're right.
Hey, if you're hungry, there's permanis in the staff lounge. There's free lunch in the lounge.
We love a free lunch.
Oh yes.
Want to make your ER staff happy? Bring us food. Oh no! Last time she was out there, the homie drop off happened.
Oh, is that what it was?
How was lunch?
It was good. Are you coming to get me?
Yeah, remember I'm coming to pick you up after my shift?
Oh, so that's why she's having the caregiver thing. Guilt.
She said that earlier.
I don't remember that.
She said it when she was like, "Oh yeah, my sister's in a facility now."
Oh, I see.
Yeah.
Hey, let's take it down
This
a notch.
is none of your business.
I am not abandoning Chrissy.
Just get the fuck out of here.
Fuck you. Hey, ladies, that's enough.
She is my daughter.
Step away.
She's my chance.
That's enough.
Security.
Yeah, I would just security, behavioral code, escort them out.
Yeah.
It's a lot of drama, but did want to say they were saying like, oh, we don't ever like get breaks in the ER. It's not that you're not allowed to have breaks. It's just there's no scheduled breaks for the doctors.
Yeah.
For the nurses, there are rules like they have to have scheduled like at least 15-minute breaks and stuff, but not for the doctors or the med students. So if you're lucky, and if you time it just right, you can go and get something to eat or pee.
Yeah.
But yeah, that is a sad episode, but.
Not as bad as some of the others.
Yeah, I would say like all of these episodes so far, like the really dramatic ones, like the last one, it's like each episode. You said this. It's like each 1 hour of the shift is like a full
month.
No, it's more like
a week.
it's like a really busy one day.
Yeah.
Like 1 hour of like this is kind of like 1 8 to 10 hour shift of like what we normally have. It would not be like this 5 hours for the first half of the shift.
Yeah.
But yeah, like it has to be like that because it's TV.
Yeah. That makes sense.
All right, well, we made it through another episode.
Just barely.
Thanks, James. And thank you guys for watching. We will be back again for episode 7. Thank you.